Hi, my name is Rick. I have prostate cancer. This is my treatment story. Okay, so as I'm driving up here to have this procedure done, I leaned over to my wife and I said, "Have I told you today that I don't really want to do this?" And she says, "But this is your best option, right?" I said, "Yeah, I think this is my best option." The treatment you pick it, you grab onto it. I think that's what today signifies for me is I'm in. There's no change in my mind. This is the best thing for me, and I'm going to go through with this like a trooper. And I think that's where you have to get to in this whole process.
My name is Dr. Christopher Amling, and I'm a urologic surgeon here at the OHSU Knight Cancer Institute. I'm part of the prostate cancer multidisciplinary team. I implanted the beacons for Rick Dancer's Calypso treatment. So the beacons for the Calypso procedure are implanted very much like a prostate biopsy procedure. It's a transrectal ultrasound-guided procedure. It takes a little less time because we're only making 3 needle sticks rather than a total usually of about 12. So it's even better tolerated than the standard biopsy procedure. Try to place them in a sort of a triangular configuration so that there's 2 beacons at the base or the upper part of the prostate and 1 beacon at the lower part of the prostate. And because we separate them like that within the prostate itself, it allows for a more accurate determination of the location of the prostate, which helps to guide the Calypso radiation treatment. So the placement of these small little seeds in the prostate, whether it's for brachytherapy, prostate radiation using brachytherapy, or whether it's the placement of the beacons for Calypso, is very well tolerated. They're permanent implants, which don't appear to have any long-term consequence. You know, here at OHSU, we really take pride in working together in a multidisciplinary effort for men who are newly diagnosed with prostate cancer. I am part of that team. I do the surgical treatment of prostate cancer, which is a very, very common treatment for early stage prostate cancer. I'm referring specifically to robotic prostatectomy, and we do a large volume of those cases, including nerve-sparing techniques, and we have the latest robotic technology here as well. And again, I think that's one of the advantages of our institution is that we have a multidisciplinary approach, meaning that it's not just surgery, it's not just radiation, and it's not just hormonal therapy or other treatment for prostate cancer. We put our heads together to try to decide and define for you, the patient, what the best form of treatment might be.
I'm Celine Sanchez. I'm a medical assistant for Dr. Amling at the OHSU Knight Cancer Institute. I'm going to go ahead and take you to the exam room. I'll have you give me a urine sample, then I'll have you back in your exam room and I'll have you undress from the waist down. What you should expect from this procedure, you'll expect to feel pain, discomfort, see some blood in your urine, blood in your semen, blood in your stool. You'll see some blood when you wipe your bottom. The blood in your urine should clear up within a few days. Blood in your semen could take the longest to clear up. It could take 6 to 12 weeks. There is a risk of infection. That's why we want you to go ahead and finish your course of antibiotics.
You put that thing in, and then there's the needle goes inside of that,
Exactly.
right? And that's the part that kind of just tingles a little bit.
Yes.
You can tell me anything I'll be feeling, because if I expect
Yes.
it, I'm better.
I will go over everything as we do it here.
Okay.
Okay, here we go. Lots of pressure from this. All right. Where's the? All right. So what we do initially here is we numb the prostate up. We do what's called a prostatic block. And so what you're going to feel here initially is a little bit of a poke, just like the dentist numbs your tooth.
Yeah.
A little poke right here.
Ow, yeah.
And we do a little poke like that, one on the left and one on the right.
Okay.
So here is the second one. You may feel this a little less because some of that
Yeah.
numbing medicine goes over to the other side.
I'll rate your shots. That was good.
Okay.
First one you need to work on.
That's right. First one's always the one we need to work on.
Yeah, it is.
We need to find a painless way to do it, right? So this is just an ultrasound of the prostate with the bladder and the prostate, and we're going to use this ultrasound image to help guide the needle to place the beacon where we want to place it.
Does this feel pretty much like a biopsy thing?
Yeah, you're going to feel a little bit more pressure
Okay.
than a regular biopsy, but we're going to advance this needle, and here we go.
I feel that. Wow. That is the weirdest. Ow, yeah. I got that. I think we took that one. Whoa. Didn't hurt, it just feels weird.
Yeah, it's a lot of pressure. I can't see it very well. This is left. Okay, left side.
Is this number 2?
Mm-hmm.
Okay. And grip this bar like that's gonna help. It doesn't hurt, it just feels weird. I know this probably isn't for video, but ow gosh, oh that one I felt.
Feel that one?
Ah. Ouch. Yeah,
Okay, and now one more.
okay.
All right, that's pretty much it. And then this,
Sorry. Just 3.
okay, here we go. That's it. It's all done. How you doing? You all right?
Yeah, yeah.
Yeah, that's kind of weird, isn't it?
It is strange,
it's a
yeah.
bigger needle than we use for the biopsy. And we have to
Yeah, you feel it a
we
lot
have
more
to
than a
advance
biopsy.
that. Yeah, we
The
have to
thing with
advance.
biopsy I hate is that snap. That's what it hurts.
Yeah.
It's like, but it wasn't that. Yeah, that's a little more intense. But it's,
Yeah,
I
that-
mean, it's not like death defying. Like
Yeah, this is a significantly bigger needle. We have to advance it through the prostate up to the top of the prostate. So that's that pressure type sensation that you were feeling. But that's essentially it. You did great.
Okay.
That's your prostate. This is a transverse section and a sagittal. What we mean a sagittal, a side section of the prostate, with your bladder up here, and this is the prostate gland, and then this is the gland cut in from top to bottom, transversely. So, but again, you can see these little areas of
That's the
those
calcification.
little dark, those white areas,
Uh-huh.
areas of calcification. And this dark area up here is your bladder, which.
So is this where your urethra goes through the prostate? Right
Actually, the urethra comes this way, right here.
Oh, okay.
This is your bladder, actually, just kind of contracted here. It's a little bit more full here, and it's contracted there.
Okay.
Yeah.
Wow.
There you go.
Yeah, it's all right. Remember that weird feeling? It kind of
You know
feels. Well, I told you about it. It just feels kind of strange.
Well, I'm glad it's over, huh?
Yeah. So now I have a little card that I have to carry with me, I think forever, that tells that there's transmitters in me,
Oh.
like who did it and when they did it, and
Oh, wow. Guess
he
you
said
just
it
keep
won't
it-
show up in an airplane or something, like it won't keep me from going on an airplane, but it's
Right.
like a
but
little
just
thing
to
like
make
that.
Sure that you have it. Oh, that's
Yeah.
good.
So,
But you didn't get put out or anything, did
no,
you?
just kind of hurt.
No.
Didn't feel good.
Okay.
But, so he was really nice.
Oh, that's good.
I didn't see the transmitters though,
Oh, you didn't?
because they already had them loaded in the needle. But I
Oh.
saw the needles when they're done. Oh, the needle that they put in there to deaden it. I'm not kidding you. It's like that thick. That's the one that hurts. And then after that, but it hurt more than the biopsy did, because there's a pressure that goes with it, and it kind of goes all the way up in the front. I mean, it's not unbearable, but it just is uncomfortable. I just grabbed
Did you see how long that'll last?
this.
No.
No, but last time I remember it was gone. I mean, it lasted a couple hours and it was gone, so it's
Oh.
not too bad. So I'll be all
Well,
right.
that's not bad. Okay.
Mentally, that was tough. That was like walking into a room and you're going, okay, I've had the biopsy, so I know where the pain factor is, but the doctor explained everything to me, so I knew exactly what was coming. I knew when the needles were coming, and it feels just like a regular biopsy, pretty much. There's a little more pressure, a little more intense, but it's not death-defying, and it's not gonna kill you. I mean, it was worth doing. The process is part of the process. Physically. right now I'm having a little bit of that pain after you've had a biopsy. Guys, if you remember that pain you had, that just, it feels, you know, it's right in that area where it just kind of feels like, almost like you have to go to the restroom. And it's, but you know you don't, but it's just kind of an achy feeling. I mean, you know, I'll go take some aspirin and I'm sure I'll be fine. I really think the mental part is the big part. You know, I'm kind of, I guess it feels weird because I'm done. I feel like I'm in now. Okay, now the rest of the process, you know, we'll see next week when we go to simulation what that is like. But right now I feel like I've cleared a major hurdle because I'm in. And there's a part of me that just wants to get this taken care of and get on with my life because I'm sick of cancer. I'm sick of being in this place. So let's go on to simulation and we'll move through the process and see where we go.
We have numbers here so that it corresponds with the couch position. So we can adjust the lasers and they're on movable tracks, and we just go in and move the lasers to where we want to.